Hello?
Hey, Dr. Bernstein? Hey, how you doing? I need to talk to you on one of your patients.
Can you tell me who this is and where you're calling from?
Sure, I'm sorry. This is Stephanie, and I'm calling from the ICU, and I'm calling about Sally Johnson. She's the one that came up here yesterday. She's the one with all the family. I mean, they are a piece of work, okay? I'm telling you, wow. Anyway, she's not looking good, and I need some help. I got here, she was okay when I got here this morning, but she's not looking good. She's definitely not okay now.
Tell me a little bit more about what's going on, Stephanie.
Sure, you know, but more or less she's having a hard time breathing. More hard time breathing than when I got here. The respiratory is here. I did call them, and they've done their thing, and it is not working very well. And she's on oxygen. Of course, she was on oxygen this morning, but she's on more oxygen now, and it's not doing enough. She's not doing so good.
What about her vital signs and recent ins and outs?
Oh, sure. I'm sorry. Hang on just one second, okay? Hey, can you read me off Sally's vital signs? The ones that are right now, please? Thank you. Not Cindy, Sally. Okay, cool. Thanks. Oh, yeah, sorry about that. 111/45, 78, 39, and 88%.
You know, Stephanie, I'd really appreciate it if you could give this to me in SBAR format.
Sure. Yeah, absolutely.
Hello?
Good morning, Dr. Bernstein. This is Stephanie calling from St. Mary's ICU. How are you this morning?
Good, Stephanie. What can I do for you?
Well, the reason I'm calling about Miss Sally Johnson. She's the 87-year-old patient that we admitted yesterday for congestive heart failure. She's over in room 440. The situation I'm calling about is her increased respiratory distress, and she's having some increased oxygen needs. You know, as far as background, she's got that long-standing cardiac history. She has had an MI in 2009. And she was hospitalized in March of that year for an episode of pulmonary edema secondary to her heart failure. She did have an echo this morning that showed her ejection fraction was down to 25%, and it was 55% this March. Also, you know, when I came on this morning, she had oxygen on, but it was about 2 liters nasal cannula. Sats were good. They were about mid-90s. She didn't have any shortness of breath or distress, and her lungs were clear at that point. As far as assessment, about 10 minutes ago, I went into the room and she was complaining of increased dyspnea. Respiratory rate was in the mid-30s. Her last set of vitals, let's see, her blood pressure was 111/45. Her heart rate was 78, and she does continue to be in sinus rhythm. Like I said, her respiratory rate's been in the 30s, and her sats are, gosh, they're about 88%, and she's on a non-rebreather now. Lung sounds, they have definitely worsened. She's audibly coarse throughout as of 10 minutes ago. I did call RT, and she's gotten all of the available treatments and not a lot of improvement at all. I do have her eyes and nose. She is about 3 liters ahead in the last 24 hours, and her urine output is marginal. It's about 230 mils for the last 8 hours. As far as recommendations, I'm just thinking maybe we should DC her IV fluids, maybe give her some Lasix, and see how well she tolerates the BiPAP. I don't know. What are your thoughts?
Well, Stephanie, I really appreciate you giving that to me in SBAR format. And I think we will go ahead with those things you recommended. Definitely stop her IV fluids. Let's give her 40 milligrams of IV Lasix and have RT put her on BiPAP. And I'd like to add one other thing, if you could get a STAT portable chest X-ray, and then I'll come see her after the X-ray is done. Thanks.
Okay, excellent. So that's 40 Lasix, 40 milligrams IV times 1 now. Stop her IV fluid, get RT to try out a BiPAP and portable chest X-ray stat, and you'll come down and check her out for me. Thank you so much, Dr. Bernstein. I'll see you soon.